Hi everyone, thank you for joining our virtual dental shadower session. We want to remind you that in order to get your hours, you will have to take a short quiz, and as long as you get a score out of 3 out of 5, you will earn your hours. The quiz link will be located in our link tree, which is in our Instagram bio. All right, so let's get started. We're very fortunate to have Dr. Julie for today's session. I am handing the mic over to you now. Feel free to start whenever you want.
Thank you guys for having me, and thanks everyone for listening and watching. I'm excited to talk to you about my life in the field of dentistry and the way I see it. So let's dive in. So I'm a general dentist, but I love cosmetic dentistry. So in order to be a cosmetic dentist, you're a general dentist, but I'll get into that. So let's get started. So a little bit about me to start, so you know where I'm coming from with all this information. This is kind of the schools I went through. So we'll start with College of Charleston. I'm from North Carolina, but I went to College of Charleston and actually got my degree in Spanish. And just so you guys know, like a little stats, just so you know what people are looking for when you apply to dental school, I basically beefed up my resume from the beginning. I was involved in a lot of organizations, and I was really busy, but I enjoyed my time in college. That's the most important thing, is to establish relationships and obviously get good grades, but get good life experience too. These are some organizations I was a part of, and I won't go through all of this. It's overwhelming. Here's some more. I was involved with a lot of things, and I recommend not just getting involved with organizations, but becoming a leader in them. Dental schools want to see that. This is all the mission work I did. Some of this was during dental school, and some of it was before. But you can see I was involved in a lot of different volunteer opportunities, and a lot of these tied back to my degree in Spanish. That's College of Charleston graduation. So the tradition is that the girls wear all white dresses and the men wear white dinner suits, dinner jackets, and you walk across the stage, which is in the middle of the cistern in College of Charleston. So, and the girls carry roses. So it's a sweet little tradition that we have. All right. I stayed in South Carolina for dental school, and I had the best friends in the world help me through it. Your friends in dental school help you through more than you realize you'll need them. But we had a great group. So this is kind of the stats behind it. Kept a pretty competitive GPA and got some awards along the way. These are some organizations I was a part of, and basically I just found what I was passionate about and I went with it. And I learned more from the experiences along the way too. These are a few questions that I get a lot. So why did I choose my dental school? I love the location, obviously. I was already here. There's other schools in Charleston, so there's a lot of young professionals. And USC has incredible clinical experience in comparison with some other schools. The things I looked for were camaraderie, support from the staff, and having other types of classes with me. Best and worst parts of dental school. I was stressed for 4 years straight, and I don't think that if someone told you they weren't stressed in dental school, they're lying to you. You have so much on your plate, and it's hard to balance. It seems like you figure out the balance as soon as you're about to graduate. It was hard to find a balance between school and real life. So that was kind of the drawbacks. The best part was the people I met along the way. It wasn't until dental school that I found people with the same intention and passions and work ethic as myself. And at that point, I was able to find true friendship in a way that I'd never experienced before. And then networking with other doctors, both in the community, at the school, and in my class. And then getting involved in organizations. That's, the time that you can get involved in things outside of the classroom. Some tips for dental school is remembering your why. So remind yourself why it is you're doing it. And that's going to help motivate you, you know, when you're studying for 5 tests at a time or whatever it is. If you remember why you're there, and maybe even write it down on a piece of paper and look at it when you're studying. Getting involved, I've already mentioned, and deeper is better than wider. So if you find a group that you're passionate about, become the president. Instead of being in 20 different organizations, become the president of one that you're passionate about. Networking with other people, other classmates, faculty. Keep competitive, but don't get so caught up on their class rank. A lot of people want to be number one, and maybe for orthodontics, you might need to be number one to get in. But if that's not the route you're wanting to take, you don't need to be in the top 5. And I found that I actually did better when I wasn't trying to be so competitive, because I was able to relax and breathe and actually focus on what matters. And then the last one, I tell myself a lot, but don't take yourself so seriously. The profession is a respected one in the community, but you also you're human first and foremost. You're a human, you're a son, daughter, wife, husband, mom, dad. Do that first, and then you're a dentist. Okay. And then I did residency at UNC-Chapel Hill in North Carolina. This is the mission or the goals for the 1-year program. So you can either do a GPR or an AEGD. GPR is a general practice residency, and AEGD is what I did, advanced education in general dentistry. They're not required to be a general dentist, but it makes you a great candidate for jobs. And a lot of people won't even consider an applicant for a dental job if you don't have either 3 years experience or you have one of these degrees. That's the main reason I did it. And then right now I'm a resident with the American Academy of General.
I wanted to take some time to talk about the AACD residency. I get a ton of questions on Instagram about it, and I wanted to take a few minutes to share a little bit of my experience and what it's all about. To preface, a lot of your questions can be answered simply by going to the AACD residency website. So here's that information. You can find most of the basics here, but I'll go into it a little bit. So it's basically a structured mentorship between the preceptor and the AACD resident. There's only several positions available every year, so it's good to do a residency beforehand to gain experience and to make yourself a competitive candidate for the program. The match system is similar to that of most specialty residencies, where you apply and the preceptors submit what they want from a resident, and then you're matched accordingly. I always recommend reaching out to the preceptors. So whereas the first half of the residency is primarily didactic and shadowing and gaining exposure, the second half is gaining experience. So the second half is structured by a series of requirements, everything from veneers to indirect and direct veneers to posterior composites, indirect restorations, onlays, and then it also dives into other procedures that may vary from practice to practice. So for me, I've been able to do quite a few crown lengthening procedures, orthodontics, and diagnostic cases such as mounting and occlusal equilibrations. This is going to be greatly determined by the type of dentistry that your preceptor practices. It's very important to note that the residency program with the AACD is completely separate from the accreditation process with the AACD. However, you're getting an incredible head start because you're doing so many repetitions of each type of required AACD case. You're documenting it along the way, you're learning to assess your work, and you're receiving the feedback from your preceptor along the way. A very common question is about the salary associated with the residency, and I'll go ahead and tell you that if you're more interested.
All right, I'm going to stop there because I drone on and on, but that video is on my Instagram if you want to watch it. So I chose to do a little further education because I'm someone that doesn't like to settle. And this quote is one that I found that I feel sums up my profession so far. Because I've constantly been seeking to go further and explore more and learn more. And I know, so the AACD is the American Academy of Cosmetic Dentistry. Cosmetic dentistry isn't a recognized specialty, like orthodontics or like oral surgery or perio or pediatric dentistry. So in order to be a cosmetic dentist, you can just write cosmetic dentist up on your door at work. But the only way to distinguish yourself within cosmetic dentistry is to become accredited with the American Academy of Cosmetic Dentistry. So that when I say AACD, that's what I'm talking about. And so there's only less than 500 accredited members of the Academy. There's less than 100 fellows. So to become accredited is the first step, and then to become a fellow is the second step. The residency I'm doing, I'm working for one of the fellows. So she's my preceptor and I'm the mentee. So I'm learning from her and watching her day to day, and then doing it with my own patients. So so this quote is near and dear to my heart, and it's been really cool in dentistry to see that the top dental providers are following this day in and day out. They're practicing, they're learning, they're at all these events to continuously learn. I chose this picture because that's me, and I'm working on the other AACD resident, Devin, and this was the first time I did a crown lengthening procedure. So what that is it's a surgical procedure, but it's an aesthetic surgical procedure. So you're taking bone from around the tooth, so the bone holds the tooth in like this, and you're removing a little bit of the bottom so that the gums start to come up. I won't bog you down with that, but that's what's going on in that picture. And we had all sorts of people in the room videographing, and it was really fun. So, all right, what's next? And this is me outside of dentistry. It's way more fun. So I do a lot of arts and crafts. I do macrame, I play beach volleyball. That's my boss, Amanda C. She's incredible. She's the one that's a fellow with the AACD. Those are some of my girlfriends from dental school. One of them just got engaged. That's me in Honduras. That was actually last March. The shutdown happened literally when I was trying to get back into the country, but I was good. So kind of crazy. That's another mission trip I did in dental school in Jamaica. That's my family. And then that's me again. So I'm from Raleigh, but I'm now in Charleston. Okay. So this is a post that I did a little while ago, but it was talking about how whether you're a student, whether you're getting into dental school, whether you're not into dental school, and so on and so forth, you can always be making yourself better. You can't blame it on circumstance, right? So during the shutdown last year, I started drawing, and it was a creative outlet, but it was also a way to practice without being able to practice in the clinic. So it's just a reminder that you can always be bettering yourself, and I'm not a fan of excuses. So just find the way to better yourself and don't make excuses, right? And that was the finished product. So that was all done with that little pencil right there. Okay, cool. And then this is a watercolor I did too. So this is for a t-shirt we made in dental school, but find your thing. And for me, my thing was artistry and dentistry, and I put the two together. So it doesn't have to be that, but for me it is. So this is a lecture I gave to actual dentists, but I'm just gonna flip through it a little bit so you can see what cosmetic dentistry is about. And you know what, before I do that, I'm gonna do a little tour of our office. So I'm not in the office, but I have a video of it. So let's see if this will play. So this is where I work. about 15 years old. And just last year, she started bringing in new dentists. So it's been fun. And then let's do this part first. Sorry, I'm all over the place, but it's more fun that way, right? So this is a case that I just did. But I'm just going to flip through real quick and show you. You see befores and afters all the time, and especially if you're into any sort of artistry, it's really fun to see that. But it's the learning and the in-between is what's most important. So how do we get from here to here? So the dentistry I do, I never want it to look fake, right? You don't want people to know that they're not real teeth. So for this patient, we did Invisalign first. And so Invisalign is the clear aligners to straighten out the teeth, right? So this is what Invisalign looks like on their website. And I'm pretty sure I'm not supposed to be taking a video of this because it's copyright, but too late. So yeah, that's Invisalign. So we did that first. So that's before Invisalign and then after. And you can see we kind of straightened everything out a little bit and got the teeth nice and lined up. And then we did what's called crown lengthening. And that's what I talked about earlier, is taking the bone from right on the front of the tooth to make more room up. So you can see the teeth got longer, and you can see that she already looks more mature. She's 24, 25 years old, and she looked really young before, like really gummy in her smile. And then afterwards, she looks about normal, you know? So that's before and then after. So you can see how gummy her smile is. And then this is after her crown lengthening. So we take a lot of videos too, not just because they look good, but it's so we can send them to the lab. The lab makes the veneers or the crowns. And because the lab can't actually meet the patient, the video is the best way for them to see it. Our lab technicians are incredible, and they are actually making the teeth fit her entire face and her personality instead of just one size fits all teeth, right? And we pay more for that, but we also charge more for it. So that's what cosmetic dentistry is kind of about. So we use all sorts of things to take measurements. This is called a face bow. And we use these to come up with the design. And then this is what I use as a guide for my design. This is part of I'll get into it, but so I do a mold over the teeth. And then I know how big the teeth are supposed to be. So I don't shave back teeth. I know you've seen the pictures of people with like little nubs, and that's not what we do. We try to keep as much tooth as possible because unlike most things in your body, you can't grow tooth, right? So it's our responsibility to not take away something that you can't grow back. So this is a way that we do that, and we do like a guide over the tooth. And then I do a specific measurement, so where the pencil lines are, so it's 0.5 millimeters. And I take 0.5 millimeters on all these lines, and that way I know how deep I have to go. I won't get too into it. But at the end, this is what it looked like. So she doesn't have to leave with like little nubs. She has almost her whole tooth there. This is an impression. So we do an impression of the tooth, all the teeth. And we do digital impressions for other things, but for cosmetic work, when they're really, really tiny, fine detail, we still do this type of impression. And then we pick a shade color. And this is so the lab can see what color the tooth is underneath. So in order for the lab to build a tooth that's the right color, they have to know what's underneath, right? Because it's so thin that the color is going to show through. So that's one of the colors. And then the other color was on this canine. It was a little darker. And the lab needs to know that so that they know how thick and how light to make the material. Because at the end of the day, you don't want to see the differences in what's underneath the veneers. You just want to see a nice color. This was verifying, these are the temporary crowns. So this is verifying the angle, and you can see here that something is off. So I drew a line between her eyes and then draw a perpendicular line down the center of her face. That splits the difference between the eyes. The eyes are usually a really good reference. Ears, everyone's ears are so crooked. Everyone's noses are crooked, but most people's eyes are pretty even. So they're usually a safe bet. So we draw a line through the eyes, and we split the middle, go down, and you want the plane of the bite of the teeth to be on the same level as the eyes. And these are her temporary teeth, and you can see my black line is not straight with the eyes, right? So then I adjusted it, and then we got it. So that was before, and then we got it pretty straight. So using photos, so we use a lot of photos, right? To look at our work and to communicate with the lab and to talk to the patient too. So that's what the teeth look like after they are prepared. And then I send 1 billion photos to our lab, and that's what they use to make the final porcelain. So this is one of the most important photos. We use different types of retractors to pull the cheeks and lips off the teeth so the lab can see. And then you can see I drew my lines again. I said, I want the teeth to be right in line with the eyes. If you send this photo, there's no reason that they shouldn't get it right in line, right? And then this gets kind of into the artistic thing. If you don't have an eye for it, you can't tell the lab what you need. So these are just some notes I gave to the lab, and I won't go through everything, but you can see where that's me drawing on the tooth. And I use Keynote to do that. It's pretty much like PowerPoint, but better. But I use Keynote to draw on the teeth and to type and to write to the lab. And I send everything down to the surface texture. This is where cosmetic dentistry is different than general dentistry. I don't know many general dentists that send pictures like this to their lab. So I said I want moderate surface texture. So young teeth have more surface texture, and old teeth have barely any surface texture. They're just straight across like a piece of glass because they brush their teeth so much for 90 years. Whereas a little kid, you'll look at their teeth and they're super bumpy, and that's normal. So when I'm doing a smile design for someone, especially in this case, she's 24, I don't want her looking like she has 80-year-old teeth when she's only 24. So I wanted moderate surface texture. I wanted a little bit of translucency. And that helps the teeth look natural. And then on the edges of the teeth, you can see the bottom photo, how it's not straight line. I wanted a little bit of uneven because uneven is natural. So this is more notes about how I wanted the teeth to be. But I want you guys to see this. It's more than just a before and after picture. It's hours and hours of communication to get that result. So it keeps going. These are the temporaries that she was wearing, temporary veneers. And I take a photo of the temporary veneers to send to the lab. That way we can make adjustments as we need to. We always let the patient wear the temporary veneers as a trial for not just the aesthetics, but for the bite, for speech. The last thing you would want is to put some permanent crowns in, and then they have a lisp, right? Or they can't bite, or they're breaking them. So this serves as our trial run, and the patient is more confident when they get the final porcelain because it's not a surprise. It's what they expected. It's what they tried out already. I'm not time. Good. This is just different angles too. And then this is what I get back from the lab. And a lot of people ask, like, what lab did you use? And it was Rigo. Rigo Lab's amazing, but it's also the communication I put in on the front end and the ethical dentistry I provided when I was doing the preparations. So this is when we tried them in. Let's see if this will play. There we go. When did they work? And then this is a photo I took of them. And yeah, I was so happy with the way they turned out. But you can see there's some texture. The edges of the teeth aren't straight across. They have a little unevenness, but at the same time, absolutely beautiful. And that picture didn't work. And then this is when we put the veneers in. We use what's called a rubber dam, and that's the blue part. It's a piece of latex that goes on the tooth or on the mouth. And then it's like if you're having surgery on your stomach you put the blanket over you and they only expose that one area. So it's for multiple reasons. It's for the patient so that nothing gets contaminated. And in dentistry, it's so nothing goes down their throat. And for the provider, I can see exactly what I'm doing. And in dentistry, you don't ever want too much water on the teeth or saliva or contaminants, or you can't bond to the tooth. So it's predictable dentistry, and it's the right thing to do. That picture didn't work. And then, so that's kind of where we are here. Let's see if we can play this part. So that was her before. She was beautiful to start with, but her teeth didn't match her personality. That was after the crown lengthening. And I'm waiting to get my final photo. She was supposed to come today, but she couldn't come. So let's just do a few minutes on smile design, and then we'll take questions after that. So to be able to come up with these treatments and to provide the treatment, you have to be able to see it. And if you don't have a clear idea of what you're going for, there's no way you can achieve success, right? So this is a quick lesson in smile design. I hit on a few of the things that I find most important. But it's good to start noticing these things. And then when you become a dentist and you go out to a bar, all you can do is stare at people's teeth and think about smile design. And it's a blessing and a curse. But anyway, so there's some main things. So incisal edge is the edge of the tooth, and then the tooth shape. Then we have color. We have proportions, which you can already look at this one and say something's off. And then you have the face, and you have photography. And those are some of the most important things. There's a million other things, but so incisal edge, incisal is like the word incisor, so the front teeth, and we're talking about the edge of the teeth, so the outline of the teeth. I'm not going to get into this, but basically it has to do with your bite. It has to do with phonetics, so saying F and V and any fricative sounds that your lip touches your top teeth are going to be affected by where that edge is. And then, of course, aesthetics. I won't get into that. So you have the incisal edge can be looked at in a few different ways. You can look at it vertically, up and down, horizontally, how far forward and back, and then sagittally. So say you're looking down straight above someone's head and you're looking at it on a plane like this. And it's important to see them all in all three, or else if you get one right, the other two are wrong, doesn't even matter, because it's your eye will catch it and your eye will notice that something isn't quite right. So the first most important thing is the amount of tooth display. So you can see here, there's one side has a little more tooth display than the other, and some of the heights are a little off. Oops. There we go. So if you know your teeth, so the canine, the eye tooth, the canine should be 0.5 millimeters, everything is in millimeters in dentistry, longer than the center teeth. And the laterals should be 0.5 shorter than the centrals. And that is kind of going out of style with the way that celebrities have their teeth now straight across in a straight line. But for something to look natural, this is important, especially for females. This is like what makes a smile look nice and feminine, more so than straight across. That's a whole nother lecture. So, and then if you look at the lip, so at age 30, you should show 3 to 4 millimeters of your top teeth. And with age, because we lose collagen and everything starts to droop, right? Your upper lip starts to come down too. And that display goes down 1 millimeter every year. So if you notice someone that's a little kid, their smile is like way up here. And then if you look on TV at someone that's speaking and they're older, it's like way down here. It's because the collagen is drooping, as is everything in the face. And has fillers is a whole nother ball game, but that's another reason people aren't showing so much of their teeth. But natural smile should be 3 to 4 millimeters of display. Around 20 to 30-year-old is normal. And so that's why we take these videos, because it's hard to capture someone in photos when they're naturally talking, right? So it's good to look at these too. Okay, horizontally. So basically your front teeth should be straight up and down. So protrusive, so that's if your teeth are sticking out, they look whiter. And if they're tucked back, they look darker. So let me show you a picture of that. So this, protrusive, so sticking out, those teeth look really bright, right? They're almost sticking out a little too far. That's my sister's teeth. And then retrusive, so this is the case we were already looking at before everything. They're tucked back a little more and they look darker. It's just the way that light bounces off. Sagittally, so looking straight down at someone. You can see I draw that same line through her eyes, and then I draw a line kind of where her arc is lined up, and it's kind of off. So if you look at her canine, it's a mirror image, right? So if you look at it, or not a mirror image, if you look at her left side, it's a little more tucked back, and the right side is a little pushed out. And these are all things, the more you see it, the more you'll recognize it. But you can see I draw this line, and that's the line between the wet, it's called the wet-dry line in cosmetic dentistry. So it's from where the lip is wet to where the lip is dry. So inside the mouth to outside the mouth. And a naturally pretty smile, the teeth fall right on that line. If you can picture models, they're always like showing their teeth lightly on this wet, dry line. It's beauty. It's what we see as beauty. And it goes for both male and female. So this patient, she's behind the line by a good bit. So I know that I have room to make her teeth bigger without them looking way too big. Right. These are all important components of smile design. And we'll get into them a little bit. Just have, for like 10, 15 more minutes. So the midline. So a cant is when something is off, angled. So instead of straight across, it's angled. So it's really important to know that a canted midline, so an angled midline, is more important than it being off center. And then you have a midline that goes down the center of your eyes, and you have a midline that goes down the center of your teeth. And you want that to be pretty much lined up within a few millimeters. And then there's several ways to look at where the center of the face is, but I usually try to go split the difference between the eyes. So that was where the center of her eyes were. Those are her canines. And then that was the center of her central teeth. So you can see we're pretty much lined up there. This is a good example in the difference between maxillary and mandibular, so upper and lower midlines. So that's the center midline, and that's the lower midline. So it's like 3 millimeters off center, right? So being off center between the upper and lower is okay. What's worse is when they're canted. And then this is an important statistic. So maxillary, so upper and lower midlines are never lined up they're only lined up in 25% of cases. It doesn't quite affect aesthetics. And the reason this photo is so blurry is because it's my teeth. So I'd like to think that I look pretty okay with my teeth, but my discrepancy between upper and lower is that far apart. But it's better to be like that than to be angled, to try to make it look like it's coinciding. So this is called the face bow. And what it is it's pretty much a replication of these lines I've been drawing. So it goes right on their ears, and then I get these lines straight across through their eyes, and then their mouth is resting on this plate, and there's some material back there to hold it into place. And I was a little off in this one actually, so that's why I take a photo. I took a photo so I could send it to the lab and say, hey, look, this is coming your way. I mailed them this. I'm saying, hey, this comes your way, and look at my photo, it's a little off, so please take that into consideration. Ideally, I would have the patient come back and redo it, but I was a little pressed. It was over Christmas break and I could not get the patient in. Yeah, so you can see I'm pretty off there. Okay, so let's talk about tooth dimensions. This is pretty bread and butter cosmetic dentistry. So the central teeth should have a width to length ratio of about 4 to 5. So 80%, 75 to 80% of the width is the height, or height is the width. And this is just a little diagram of that. And then this gets a little more in depth, but the buccal corridor, so everything from the canines forward is considered the aesthetic zone. Everything back is the back of the mouth, the posterior. But what that's called is the buccal corridor. So you think corridor is space, right, that isn't filled. So in her case, the buccal corridor has more gums and cheeks than it has teeth. And so we say that she's a little weak in the buccal corridor. She could use a little more white. She could use a little more teeth back there. So that's this area and that area. So these are some of the things that contribute to what the buccal corridor looks like and is composed of. So the arch form, so some people's arches, so we're talking this way. Some people's are really wide and broad. Some people's are really narrow. And some people's are more triangular. There's square shaped and there's circular, ovoid. It has to do with that, it has to do with the muscle tone of the cheeks. It has to do with the position of the top teeth and where the canines are. And I should say value discrepancies, sorry. But it has to do with if the back teeth are really dark, say someone has silver fillings back there, that's gonna throw it off a little bit. Or say someone has 6 veneers that are bright, bright white in the front and nothing in the back. It's gonna look like it dropped off and there's just complete darkness behind it. That's what we try not to do, right? So ideally, the bicuspids, so the teeth that are kind of in those rectangles, those pink rectangles, should fill in that space. The canine, the eye tooth, should be right at the lip. And let's just say broad, sorry, a lot of typos in this one. Broad U-shaped arch form is what's considered aesthetic, and it fills in the buccal corridor the best. Something else, we'll talk about that in a minute. Okay, so this is when things get a little tricky. So the interproximal contact area. So this is between the teeth. And these are things that I could say most general dentists don't look at, but when you're doing a lot of cosmetics, it's critical. So we call it the 50-40-30 rule. So 50% of the whole tooth height is where the teeth are touching in the center teeth, the central incisors. You move back one, and 40% of the height of the tooth is in contact with the tooth behind it. You move back one to the lateral incisor in the canine, and you're at about 30%. And I mean, that's give and take a lot of times, but it should at least decrease as you go further back in the mouth. And then the interproximal contact point. So that's the start of the contact when you're going up. So if you look at where those dots are, the first one is the lowest. So between the two center teeth, the part where the teeth contact first coming up is low. And then you go back one and it gets higher. And you go back another and it gets higher. It goes back and it gets higher and higher and higher as you go back. If you don't do that, it doesn't look natural. So this is a part of cosmetic dentistry that has a lot to do with artistry. And sometimes if you don't have an artistic eye, you can't put your finger on what looks wrong. So I want you guys to be able to start to see these things so you can start pointing it out. And then from there, you'll know later what to do with it. So there's negative space and positive space. So positive space is focal points and the gums and the teeth. Negative space is the space where there is nothing. So that's when you smile, open mouth smile. It's the space that there are no teeth. That's negative space. And it helps the positive space have character. Okay, so negative space. So in this situation, that's negative space. That's negative space. That's negative space. And hopefully you can see that. It's the places where the teeth aren't. And these are called incisal embrasures. Incisal meaning the edge of the teeth, embrasures meaning an opening. So the openings between the teeth. And then we have positive space, looking at the same thing, just in a different way. So this part is going to get a little hairy. So this is your lateral tooth. So just bear with me. So you have a circle and it's relative ratios. So there's no unit. It's just one, okay? 2/3 of that one. So the one is the back angle of the tooth. The 2/3 is the front angle of the tooth. And we're looking at that incisal outline. So the line that goes underneath the tooth before the black. And then we use that 2/3 again for that angle. And then we use 1/3 for the front. This person's tooth was broken, so it's not a good example. But using that, I knew what type of shape to make that angle to make it look natural. And then tooth dimensions. So there's a golden proportion in teeth. And this is from photos, not from looking at the tooth itself. Let's just look at the picture here. So the ideal proportion goes from the lateral incisor, and it compares the central incisor and the canine to the lateral incisor. So the central should be 1.6 times the lateral. The canine should be 0.6 times the lateral. And that's pretty standard. And that's from a photo, not from looking at the patient and measuring. So if you see here, I measured on the photo. I didn't measure the actual tooth because it's aesthetics. It's what you're seeing when you look straight onto the person. All right. I'll do a few more and then we'll do questions. So then we look at the gums, the gingiva. So gingival means the gums. So we look at the levels here. And I drew these marks so you can see where they are. And you can see things are pretty asymmetrical, right? So we have some room to move them around to get them more even. So we want the canines and the centrals to be on the same line. And we want the laterals to be a little lower. But here, we're kind of all over the place. So we have a lot of cleaning up to do. And you can look, if you guys ever want to, my Instagram is free range. I put up everything because I just want people to learn and people to be excited about this sort of thing. But you can see the before and after of this on there. And then we also have the shape of the gums. So we want the centrals and the canines to have this kind of elliptical shape, so like a circular shape. And the laterals, we want to be a little more pointed, not triangular, but ovate. So kind of between a half circle and a triangle. If you have a rounded triangle, that's kind of what it would be like. So egg-shaped, right? And then smile line, so relating everything back to the lips. So we want the incisal edges to follow the lip line. Right there. And we're pretty much there. And then some things to keep in mind. The line between the eyes, the interpupillary line. We've talked about that a million times now. It's perpendicular to the midline of the face. The lips are the frame of the smile. And the tooth morphology depends on facial morphology. So what that means is if you have a 90-year-old man in your chair, he's certainly not getting the veneers that this patient got. They wouldn't fit his face. They would be too young looking. They would be too feminine looking. They would have too much texture. So you always have to keep in mind the facial morphology when you're treating the patient's teeth. these are two books that I love. And I read a lot of books this summer, but these two are my favorite. The one on the right is a little thinner. The one on the left is a little thicker. Pascal Meunier is amazing. And if you really are interested in cosmetic dentistry, this book will get you amped up. It's scientific literature, but artistry, and it's awesome. The one on the right is good for aesthetics. It talks about different tooth forms and tooth morphologies. They're both just beautiful books, and I refer to them a lot. These are just different artistic words that we use day to day when we're talking about teeth. And then I'll end on this, but we take a lot of photos in cosmetic dentistry. And we were talking about this earlier before everyone hopped on, but it's so important to have good photography. You can have amazing dentistry, terrible photography, terrible website, terrible social media presence, and no one's ever going to find you. But at the same time, if your social media and your website's on point, but your dentistry doesn't match it, you're still way off. You're selling something you don't have, right? So your level of dentistry needs to match your level of photography. So why not get really good at both, right? So I take photos on every case. And this is just a quick video of me like editing the photos. Oh, my computer's gonna freeze. These are the photos I take on every patient. These are the photos that are required by the Academy of Cosmetic Dentistry for your accreditation cases. So it's very strict with photography. The lighting has to be correct. The positioning has to be correct of everything. But these are the 12 photos that are required of every case. So you might as well get really good at practicing these, right? So this is kind of my like end slides, but I always want to leave on something like positive that I wish I knew when I was maybe in your shoes. And there's so many different charts like this that talk about life balance, work-life balance. But for me, I'm obviously a visual learner. And so seeing these helps me kind of put things into perspective. So you need to be balanced in all these 7 areas. Call them what you want, make it 3 areas, 20 areas, you need to be balanced, right? And this is kind of where I want to be. But then this is kind of where I was in dental school. I was pretty good about health and wellness because I like to work out. I pretty much was still having hobbies, hanging out with my friends, and I was 100% contributing to my career, right? Dental school. Everything else kind of dropped. You know, I didn't prioritize the things that I wish I could have. And it's tough, but you really just need to aim to try to give yourself that time to stay connected with your family, friends, spiritually, financially, everything. And I saw it happen to a lot of friends too during that time. So, you know, it's not the best time. You're studying so much, but you need to stay grounded and remember, you know, why you're here. That's enough preaching. So yeah, this is my information. I'd love to stay in touch with you guys. It's probably easiest to message me on Instagram, as crazy as that sounds, but I get so many emails during the day that I don't want anyone to get lost. So message me, connect with me, tag me in your stuff. I like watching people grow. It's such a cool profession from high school to retirement. I mean, it's really cool connecting with people in all different areas. So that is all I have for you today. Thank you so much for having me, and I guess we'll take questions.
Okay, thank you so much, Dr. Deary, for that. So our first question is, how competitive is cosmetic residency generally?
Yeah, that's a good question. So it's kind of tricky. So it's a new program. So I have a feeling that it's going to get really competitive really fast. But right now there's only about 4 or 5 spots every year. It's new. So what it is it depends on the preceptors. So there's only 3 to 5 preceptors a year accepting residents. So it kind of depends on what they're looking for in a mentee, and they're kind of spread all over the United States. So to answer your question, it's more so they want to know that you're committed. It's going to be less about grades and less about, you want to have a strong resume, obviously, but it's about the connection that you have with the preceptor and your commitment to cosmetic dentistry. So I don't have a good straightforward answer on that. Sorry.
That's good. So for the next question is, when you were talking about visualizing how to artistically fix a patient's set of teeth, did it become a natural thing for you to figure out, or did it take time for you to grasp and understand how?
Yeah, I mean, definitely both. I do find myself as more artistically in tune, but all these things that I talked to you about, like all these different slides, I learned like these past few years. I'd say, those teeth don't look right, but I couldn't tell you why. I would tell you they're too dark or too light, or they're too big or too small. But it wasn't these like little things. So when you start to look at these books and learn, and there's lectures online you can find, there's all sorts of things if you search. Hopefully you can use my Instagram and learn from there. But some of it is artistic, and a lot of it's learned. So I'd say mostly learned, but if you're committed to it, you'll learn faster.
So the next question is, what is the cutback technique that you mentioned earlier?
Oh gosh. So that's a good question. So what it is, and I'm going to try to do it in simple terms. So I have a mold of the teeth that we designed digitally. So we use the old patient's teeth, and we scan it 3D, and we make a 3D model of the teeth. And then we digitally design the teeth to be perfect. And we use a mold of that and then we fill it up with material and do a mold on their teeth. So they have these like fake teeth that aren't really there, but they're on their teeth. And then I cut 5 millimeters, 0.3 to 0.5 millimeters. So barely anything cut in, because that's how much material I need for the final veneers. And so I cut in that much, and then I take away 0.5 on all the teeth where I need the veneers to be. And that's how I know that my lab will have 0.5 millimeters of room to do the restorations. And so a lot of times with crowns that aren't aesthetic, that aren't veneers, you need like 2 millimeters or 1.5 or 1 millimeter. But for veneers, they're super thin. And so you only need like 0.5 millimeters. So that's a way to know that I'm not just blindly cutting the tooth. I'm only cutting what I need to. So hopefully that helps.
Okay. So what is the most common myth patients come in with?
There's a lot of them. Charcoal toothpaste. They think that's how they're going to whiten their teeth. Any type of whitening toothpaste, they think that's the best thing to whiten their teeth, and it's not. It shaves the tooth away. I have a lot of these, but one of them is, are you going to shave my teeth down? And I just got off the phone with a potential patient, and that was her biggest concern. She's like, I want to do cosmetic dentistry, but I don't want to shave my teeth down. And I show her that same picture. I say, you might have to take away a little bit and smooth it out and recontour, but I don't have to do those little like nubs that you see on Snapchat or whatever it is now. So, yeah.
What is the biggest difference between undergrad and dental school?
There's a lot. I would say like the people. So like in dental or in undergrad, you're in a room with 10 friends and they're all majoring in completely different things. They might be in your science classes, but they're not in dentistry. Whereas in dental school, you're surrounded with dental like-minded people all the time. Whereas they're still kind of different. I had friends that wanted to do oral surgery, and then I had friends that wanted to do orthodontics who hated pulling teeth. They're all there because they worked their butts off in undergrad, and they're all there because they are committed to a hardworking career. And and they all want to give back to the community, and they all are science minded, but also like want to give back and be a big part of their community. So I think it's just the overall, like, who you're surrounding yourself with. And I'm still such good friends with my college friends, and I'm good friends with my dental school friends, but it's just a different vibe. And it's for the best.
What was the toughest thing to learn about dealing with dental school?
Say that again. So dealing with dental school.
Yeah, what was the toughest thing to learn about dealing with dental school? Like I think what they're trying to ask is like the hardest part about it.
The hardest part of dental.
And how you learn to deal with it.
Yeah, I think time management. And I think a lot of people will tell you that, like, whereas med school has like step 1, step 2, and all these like 6-month apart blocks or months apart. Dental school is like, I wish I had my planner. I still have my planner from dental school because it was crazy. It was like a quiz every other day for the week, and then a test on Friday, but then the next week was finals. And you had to do lab work. Like, you had to wax up a tooth, and you had a patient you had to call, and you had to shadow someone in the same week. And you had social obligations. Say you had a friend's wedding that weekend, or your family was visiting. That was the hardest thing, was how to figure out, all right, I can wake up at 6 a.m. on Sunday, study for 2 hours and see my family, and then study for that test and then go to the lab. So time management was hard, but you just kind of go with it and learn from your mistakes. So you'll make it through either way.
As for our last question, what's your favorite procedure to do?
I like cosmetic bonding, so with composite. So there's porcelain veneers, and then there's composite veneers. And you can actually see, I don't know if you can still see my screen, but this one right here was composite veneers, and there's the 2 front teeth. So what it is it's instead of the patient having to come back to get their final veneers, you just add a little bit to the tooth with composite filling material. So it's the same material that you use to do fillings, but we put them on the front of the teeth to fill in any spaces or to smooth something out or to change the color. And that's my favorite, because the patient can leave that day with a new smile. And it's in my hands to get to use the composite for myself to sculpt it and to make it the right color and shape and texture. Whereas some dentists like to send it to the lab, and the lab technician makes the veneer. I think it's fun to do it same day and do it for the patient before they leave.
Okay, so that is it for question and answers. Thank you, Dr. Julie, for taking the time to talk to us about your profession. It was truly appreciated, and I know I learned a lot from your presentation. To our viewers, our quiz is linked in our link tree and in the description of this video. The quiz will stay open for 24 hours, after which it will close and the scores will be sent out. And remember, a 3 out of 5 is required to receive credit for our session. To Dr. Julie, I want to thank you again for today. Everyone, have a great day.